patient that he sees. On average, he'll see 25 patients every day, and that equates to 75 minutes saved every day. These 75 minutes can be used to see 6 additional patients. In the course of 1 month, 100 more patients will have the ability to have access to healthcare through just this one doctor. Now, every doctor is paid on an appointment basis and earns on average $60 per appointment. But we're not just here to talk about the doctor's time and money. In 2010, 4.4 million Canadians over the age of 12 reported that they did not have access to a family doctor. Now, these are the patients that are in the emergency care centers, the emergency rooms, walk-in clinics, and going to community health centers, just because a family doctor does not have enough time to see this patient. And even in the walk-in basis and purpose, these clinics are turning away patients 2 to 3 hours before the clinic closes. So whether this example has a doctor for a family physician purpose or walk-in clinic purpose, by helping a doctor save time, we're helping more Canadians get access to healthcare. Now, our solution to help save doctors time is the customizable electronic forms that doctors can create in order to collect information from patients rather before or after the appointment. Now, we provide 3 different values for 3 different stakeholders. The first being doctors. We save doctors time because if the patients are able to answer the questions that the doctor wants answered, then they don't need to interview the patient during the appointment time, as well as saving them time on documentation, because our electronic size form allows the patient to fill it out. It's already digitalized. It can go straight into the electronic medical record system. Secondly, for patients, we've all been there. We've all experienced white coat allergy syndrome. When we're in front of a doctor, all of a sudden our blood pressure goes higher, and then we can't even remember what type of symptoms we were experiencing. Was that a headache or a fever that we were feeling? And this is especially important for elderly patients. And with a long list of medications, how are they supposed to remember when put on the spot? And even younger patients like you and I, after surgery, we might not remember the antibiotics that we're on, as well as what happened in the hospital room. So we're allowing patients to come better prepared for this appointment through filling it online so they can take the time to thoroughly think through the doctor's questions and do their research so that they can get better care within the doctor's office. And of course, we've all filled out those menial forms that ask repetitive questions, even though we're going to the same walk-in clinics. Well, thank gosh for autocorrect and autofill on your phone, laptop, and tablets. Lastly, for the public sector, as well as the government. The Canadian government is subsidizing for doctors to take on EMR systems. As can be seen on this graph, over the past 5 years, EMR adoption rates have increased from 20% to 59%. Now, this will continue to grow until it hits 100% because that is the goal of the Canadian government, for every doctor, every physician to have access to an EMR system. Once they have taken on an EMR system, it makes them ready to adopt a better IT solution like ours that complements this EMR system, to collect patient information directly, already digitalized, to put it in the EMR system so that the administrative assistant doesn't need to take those paper forms and then scan them, index them, and put them in the right profile. Here's a demo of our product. Every doctor will have their own account. When they sign in, they'll have a database of preset forms, or they can create their own and edit. So they can input a text field or a multiple choice grid field question. Once they're done, they can save changes and copy this link to be sent via email, put on their website, or put on a poster in the walk-in room. Once the patient has filled it out, they'll enter a security key, which encrypts this information so that only the doctor can access it. And once that happens, the doctor will be able to edit the form in case there are any mistakes before placing it into the EMR system through PDF or through copying. This is a form behind me that a family physician is currently trialing and using in Kingston. We have gauged a lot of interest all over Ontario from emergency rooms and urgent care centers who want to use it to help their triage process, which is the bottleneck of what slows down emergency rooms, but also for family physicians that want to, for a follow-up purpose, and specialists who wanted to better communicate, a more secure measure of communicating with their patients. But our field does not just end here. Our market isn't just these medical institutions in Ontario. There are 75,000 doctors in Canada today, and this number is growing by 4% every year. There's nearly 1 million doctors in the United States, and there's always going to be a shortage of doctors because everyone gets sick, and doctors are just a necessity to society. But these numbers don't include the dentists, the chiropractors, the orthodontists, and healthcare teams, and these are all part of our market because they all need intake forms. In fact, people of different industries, such as lawyers, will need our intake form because they have clients. In fact, one of the executive directors of an immigrant wellness center wanted to use this product for his own clients, not just for a healthcare purpose. We have received a market intelligence analysis from Mars Discovery District through LaunchLab, and they have reported back to us that we have very few competitors in this market. So far, these competitors rather do preset or customizable form, or they only do pre-appointment or post-appointment bookings. Now, Aegli does it all. We do follow-up and we do pre-appointments as well. There will be a preset database and customizable forms for the doctor to use. Our go-to-market strategy will begin in 2015 because we want to spend the remainder of 2013 doing meaningful trials. We understand that the industry is incredibly slow-moving and very risk-averse, so we want to spend the time gaining customer trust and satisfaction. In 2014, we hope to have 100 doctors on board, and these will be our early adopters, and they can share through peer-to-peer networks. They're the peer leaders of Canada Info-Way systems. Beginning in 2015, we will start integrating with healthcare startups such as OpenCare and Citata, both of whom we began to develop a relationship with. For example, OpenCare does online appointment booking, so once they have booked an appointment, our form would pop up. And then we will also go through indirect sales with PointCare or PointHealth and such distributors because we know that direct sales are not quite sustainable. Our sales projections is a high and low version. We're going through a revenue model of $150 per month per doctor for the first year, and then in following years we're going to about $2,400 to $6,000 based on the value of revenue that we are able to bring to the doctor using our product. As you can see, even on the low scale, we plan to hit $1 million in sales revenue by the end of 2015. But of course, we understand that we know that our product is absolutely fabulous, but it is our management team that is really putting it together. And I have been extremely fortunate to work with Ward this summer. He's an engineering physics graduate and will be joining Aegli full-time, starting, I guess, tomorrow. And I'm a commerce student. I still have 2 more years to go, but I will be taking his course load. His main strength is in his technical background in web development, while I have interned at consulting firms in the health and benefits department. But what brought us together was a similar vision that we wanted to do something with a social purpose. And what better way to do that than to help doctors who have the ability to save so many lives and help so many people lead better, healthier lives. Now, we know that since our skill sets are so diverse and there are gaps, we have hired a student from the University of Waterloo in computer science. Trevor is a very talented software developer with a lot of background and expertise in privacy background backend side of technology. And the 3 of us are very excited to move forward with our venture starting tomorrow. But of course, what do the 3 of us really know about the healthcare industry? We are just 3 newly grad students, but we do because we've talked to all these people this summer from the healthcare industry that have expertise and specialize in the IT of healthcare. These include chief of nursing, director of patient care of hospitals, CEOs and CTOs and founders of other healthcare startups, the chairman of the Wait Time Alliance, eHealth Ontario, and this entire list. So we've tried to get feedback to develop a really great product that doctors can actually use, as well as understanding a bit more about the industry from these special people. So what we're asking for is $25,000, which is the first prize. And this will cover all the costs, as all the money will go to marketing, sales acquisition, product development until we break even in the middle of next year. We all know that the healthcare IT industry is going to boom in the next 5 years. And the time to be in this business is right now. This is a wonderful business opportunity, but also for a social purpose. We want to help